This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello, and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Ilara, Research Fellow. Today we're looking at a fascinating new study from the PloS One journal, published in 2026, titled Minimally Invasive Resection of Deep-Seated Subcortical and Intraventricular Lesions using an Integrated Camera Port System, a retrospective case series.
This is a timely topic, Ilara. As we all know, approaching deep intraaxial and intraventricular lesions present unique operative challenges. We're always balancing the need for maximal resection against the elevated risk of iatrogenic neurologic injury, the proximity to eloquent structures, and the difficulty of visualizing deep, dark surgical corridors often make these cases some of the most taxing in our field.
Exactly. And that's what this paper from Robert G. Briggs and the team at the Keck School of Medicine of USC addresses. They're looking at how we can minimize collateral damage to adjacent healthy brain tissue using port-based technology. Specifically, they focus on the Aurora Surgiscope.
Now, for the residents listening, we've seen a big shift over the last decade. We've moved from traditional blade retractors toward tubular retractors like the BrainPath or the ViewSight system. Why is that transition so important for deep-seated targets?
The paper highlights a few key advantages of tubular retractors. First, they allow for smaller craniotomies and dural openings. But more importantly, they utilize circumferential dilation and displacement of healthy brain parenchyma during insertion, rather than transection. This allows for transsulcal access and reduces the likelihood of retraction injury because of the radial distribution of forces.
Right. The radial distribution is key. But there's always been a bottleneck with existing ports. If you're using a standard port, you still need a separate external lighting and visualization system, usually a microscope, an exoscope, or an endoscope, to see down that collinear corridor. This paper introduces a tool that changes that setup.
That's the core of this study. The Aurora Surgiscope is described as a single-use camera port retractor with integrated lighting and visualization capabilities. Unlike the systems we're used to, it's an all-in-one device. The camera is right there in the port.
Let's dive into the data. This was a retrospective single-center series. What was the patient cohort like?
They reviewed 25 adult patients treated between January 2021 and December 2024. It was a diverse set of pathologies. The most common were colloid cysts, which made up 24% of the cases. They also treated intraparenchymal hematomas, or IPH, at 20%.